Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. In this segment, we're going to have a conversation with Dr. Imamu Tomlinson, CEO of Vituity, and a practicing emergency physician as well. He's joining us on the program to talk about discrimination as a Black American and how it's influenced his approach to leadership and his approach to medicine. Welcome to the program, Dr. Imamu Tomlinson, and thank you so much for taking the time with us this evening.
Thank you for having me, Neil. I appreciate it.
Give us a bit of your background and talk about your role there at Vituity as CEO.
Yeah, absolutely. So I am an ER doc by training, trained in the Midwest, came to California, and so I practice currently in Selma, California. It was right in the middle of California, what we call Central California. I'm also the CEO of Vituity, and Vituity is a physician-led, physician-owned, multi-specialty partnership. And so we're in about 17 or 18 states, and we take care of about almost 7 million patients annually, and our goal really is to take care of about 10 million patients by 2023. So our focus is really to improve the lives of patients, obviously through healthcare.
Everything is tied to healthcare, even more so in light of this pandemic that we're dealing with now. Everything is tied to healthcare. We said that you were going to talk about some of the disparities in healthcare, racial disparities in particular. Give us a bit of your take on some of these disparities, where they exist.
Absolutely. You know, we're seeing during the midst of this pandemic that different areas of the country, different urban versus suburban versus rural areas, and we are also seeing different races that are affected differently by COVID. And that's nothing new for us in healthcare. We always knew that race and racial disparities played a role, but we're seeing that some people are more affected than others. And what I've identified both personally and professionally is that oftentimes, for different reasons, we leave out certain subsets of the community and of different communities to make sure that we're providing care in the right way for that particular community. And I think when these disparities come in, you get different outcomes. So you may have one group of people who have diabetes that have a great outcome in certain areas, and then you have another group of people that don't have as good an outcome with similar medical intervention. So how can we look at those things that affect them, their diets, their communities, where they live, the air quality, that would allow us to treat them better?
Mm-hmm. Are all of these things that you mentioned, these disparities, could some of them be philosophy of how to treat patients as opposed to, as you said, ignoring certain swatches of the population? And when you say ignore, are you talking ignore or less access to better care?
Yeah, I think it's multifaceted, right? You have, when I say ignore, what I mean is that traditionally certain populations, we don't know enough about them. In the African American community, for example, how many studies have been done about how they manage their diabetes? What can we do for them culturally to make sure that we get similar outcomes to other populations? And also some of the medicine is actually different based on their cultural outlook and also America's history. I mean, we try to ignore it, I think, sometimes, but America has had, when it comes to race, a very difficult history. And so the amount of trust that certain populations have in the government, in healthcare, in me as a physician, those things need to be addressed. So when I look at disparities, I really look at, where does a person live? What culture are they? What are cultural effects? What effects from their culture will affect their care?
Now, a disparity does not necessarily mean an injustice. There are disparities that are actually the result of deliberate injustices. Am I wrong in that thinking?
You're absolutely correct. I mean, if you know the story in Tuskegee, right, and how, those patients were treated differently because they were African American. So clearly there are disparities, and then there are also inequities. And inequities are purposeful as far as a particular population of people are treated a certain way for lots of different reasons, and one of them is racism and bigotry. So we definitely want to make sure that we deal with those disparities which occur based on geography or even just demographic, and also address inequities which are sometimes, purposeful and sometimes things that we haven't addressed throughout our history.
Well, with everything, as I said, being tied to healthcare, how can, in your view, healthcare serve as kind of an equalizer?
That's a great question. And you mentioned the answer in your question. Illness is the great equalizer. It's really universal. Sickness and illness and actually wellness, it really applies to everybody. So I think if we look at that and we look at treating people first, treating them for their illnesses, but also their health and well-being and understanding where they come from, I think that's the key. The key is to look at every patient as equal and look at every patient as a person to make sure that we're addressing all the issues that they may have coming through the door.
Does awareness need to be raised from within these communities, or do we need to attack where the big bucks are down into these communities?
I think it's both. I think that we want to make sure that within these communities we connect with those individuals. One of the things that is very important to me is to make sure that we inspire and mentor young people who are underrepresented in healthcare. So having people that have the same issues as you, the same culture as you, allows you to respond in your particular community to make sure that you get the care you need. But let's face it, right? You can't just do it at a grassroots level. Mm-hmm. Organizations like ours and large organizations and also the government, I think we need to attack this from on a large scale to make sure that we declare, if you will, that injustices will be addressed. And we're doing a lot of that in our organization also.
Do you think that going forward, some of these disparities and injustices will be identified faster via telehealth, telemedicine, as opposed to how quickly or slowly they were identified when everything was touch?
I think the iron is hot in respect to social injustice and healthcare injustice, so I feel that there's a lot more awareness of it. I think that telehealth and going to bring the patient to these different modalities to make sure that we're connecting with patients through iPhones and through phones and other things will help. I do worry, though, a little bit about technology. While there is a healthcare disparity, there also is a technology disparity. Mm-hmm. So we have to make sure that as we move to these teleproducts, that we make sure that all people have access. Mm. So I think it's a little plus minus. I'm encouraged by the amount of people that we can touch through a telecapability. But I also want to make sure that we reach out and find these people in their communities and really touch them and connect with them in ways that sometimes you can't do through a teleproduct.
Give our listeners some online resources where we can learn some more about Vituity and maybe get some insight into some of the disparities that we've been discussing here. Absolutely.
I think first and foremost, you can connect with our website at Vituity.com. You can always reach out to me on LinkedIn, Twitter, Facebook. I'm on all the platforms, and we also have Vituity on there. I think that's a good first step, and on those websites and social media platforms, you can find resources to connect you with other ways to impact healthcare injustice.
Dr. Tomlinson, I appreciate you joining us here this evening on Health Professional Radio.
I appreciate you having me. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Imamu Tomlinson, CEO of Vituity. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.